Extrinsic Allergic Alveolitis. What is extrinsic allergic alveolitis? Extrinsic allergic is also known as hypersensitivity pneumonitis. It is a condition that is caused by hypersensitivity and induced lung damage due to a variety of inhaled organic particles. So it is basically a hypersensitivity reaction in the alveoli to inhaled organic particles. Inhaled organic particles, they include spores of Saccharopolyspora or avian proteins that are present in the bird's feathers, or Aspergillus clavitus that is present in the people who are working in the bakeries. Thermophilic actinomycetes that are present in the mushrooms. So someone with a history of farming, a farmer, or someone with exposure to or who has kept birds as a pet, or a malt worker or a mushroom worker who present to you with shortness of breath, dry cough, and fever, then you will suspect extrinsic allergic alveolitis or hypersensitivity pneumonitis. So a farmer, a malt worker, a mushroom worker, a cattle worker, ventilation system worker, vets, people working with grain and flour, and those whose job involves working with chemicals, and they present to you with symptoms such as fever, dry cough, shortness of breath, you will suspect extrinsic allergic alveolitis or hypersensitivity pneumonitis.
So all of these are different people working in different fields. So is this just the allergy that happens with it, or is it like a specific allergens that
There
causes?
are specific allergen associated with these uh, occupations. Basically, they are organic particles,
Right.
which when they are inhaled, I have given you the examples that in case of someone with who's has birds as pets, birds feathers has avian proteins,
Oh,
and farmers are exposed to Saccharopolysporas, and malt worker are exposed to Aspergillus clavitus. So in short, you can say that they are exposed to inhaled organic particles,
right.
which can, which when inhaled can result in a hypersensitivity reaction. So that's why it is known as extrinsic allergic alveolitis. That is, there is an extrinsic allergen that when enters in the lungs, it results in a hypersensitivity reaction.
So they have all of them. They will have the same symptoms and signs.
Yes, symptoms will be same.
Okay.
He is a farmer. If he is a farmer, it will be known as the other name for extrinsic allergic alveolitis in farmer is farmer's lung. And for birds, if the cause is birds, then it will be known as bird fancier's lung, and malt worker's lung, and mushroom lungs, depending upon the occupation of the patient. Presentation will be same in all the cases, and management will also be same.
Okay. Thank you.
Initial investigation is chest X-ray, which will show upper or middle zone fibrosis and diffuse micronodular interstitial shadowing. So X-ray will show, this is an important point, micronodular interstitial shadowing will be present on a chest X-ray. Bronchoalveolar lavage will show lymphocytosis, and in blood there will be no eosinophilia. Because extrinsic allergic alveolitis is a type 3 hypersensitivity reaction. And eosinophils are involved in type 1 hypersensitivity reaction. So on blood complete blood picture, you will not see any eosinophilia. The management is simple. Either remove the lantern and give the patient oxygen, and anti-inflammatory medication such as oral prednisolone can be used. And if the person has having chronic disease, then he should be advised to avoid exposure to the allergen or wear a face mask or a positive pressure helmet. And long-term steroids can also be used in the management of chronic hypersensitivity pneumonitis. So this was all about extrinsic allergic alveolitis or hypersensitivity pneumonitis. Our next topic is idiopathic pulmonary fibrosis. The other name for idiopathic pulmonary fibrosis is cryptogenic fibrosing alveolitis. As its name indicates, idiopathic pulmonary fibrosis, there is pulmonary fibrosis without any cause, without known cause. If the cause of pulmonary fibrosis is not known, it is known as idiopathic pulmonary fibrosis or cryptogenic fibrosing alveolitis. It is a chronic lung condition that is characterized by progressive fibrosis. So there is fibrosis in the lungs without any reasons. Fibrosis can be caused by medications such as bleomycin, connective tissue diseases, and asbestosis. But if the cause of the fibrosis is not known, then it is known as idiopathic pulmonary fibrosis. And idiopathic pulmonary fibrosis, it is common in male patients, typically between age of 50 to 70 years. And the features of idiopathic pulmonary fibrosis is dry cough, clubbing, dyspnea, and bibasal crackles on auscultation. Because it is a fibrotic lung disease, so on spirometry, there will be a restrictive pattern. What is a restrictive pattern on spirometry? Restrictive pattern is an increased ratio of FEV1 over FVC. High resolution CT scan will show honeycomb appearance, honeycombing or honeycomb appearance. Initially, there will be ground glass opacities and then there will be honeycombing or honeycomb appearance. So an old male who present to you with dry cough, clubbing, or bibasal crackles, and there is no history of any occupational exposure to any type of organic particles or inorganic particles such as asbestos, then you will suspect idiopathic pulmonary fibrosis. Chest X-ray or high resolution scan will show honeycombing. Initially, there will be ground glass opacities and then honeycombing in later stages. Because the cause of idiopathic pulmonary fibrosis is not known, so this disease also has a very poor progress, poor prognosis, and the average life expectancy is around 3 to 4 years after the diagnosis. There's a drug that is recommended by NICE guidelines, an anti-fibrotic agent such as periphenidone. It is sometimes it may be useful in selected patients, but in most of the patient, only pulmonary rehabilitation is done for symptomatic treatment. So an old man with dry cough, bibasal crackles on auscultation, X-ray show honeycombing, your diagnosis will be idiopathic pulmonary fibrosis. So idiopathic pulmonary fibrosis, hypersensitivity pneumonitis, cold worker pneumoconiosis, silicosis, sarcoidosis, these are the conditions that can cause the lung fibrosis. So there are some conditions which cause causes upper lobe fibrosis, and some condition they can cause lower zone fibrosis. Mnemonic for the causes of upper zone fibrosis, they include cold worker pneumoconiosis, hypersensitivity pneumonitis, ankylosing spondylitis, radiation, tuberculosis, silicosis, and sarcoidosis. While idiopathic pulmonary fibrosis, SLE, drugs such as bleomycin, methotrexate, and asbestos, they causes lower zone fibrosis. So this was all about idiopathic pulmonary fibrosis, hypersensitivity pneumonitis, and different causes of lung fibrosis.